Good afternoon, Victoria. I'd like to go over a couple of reminders and updates before our presenters begin today. We encourage Victoria residents to wear cloth facial coverings while in public for essential trips. Also, with the upcoming holiday this weekend, we will not have press briefings from Good Friday to Easter Sunday of this week. The hotline will be closed as well, with normal communication operations resuming Monday, April 13th. We will still post daily COVID-19 counts to social media and any relevant updates or breaking information over that weekend should it become necessary. As of 2:30 p.m. today, we have 2 new cases. These are still being investigated. Total case count brings us to 61 in Victoria County. 8 have since recovered and 9 are hospitalized. Please note that these are all still under investigation. Numbers will be updated at 5 p.m. today, and an infographic with those updated numbers will be posted afterward on the city and the county's Facebook pages. Today, as you can see, we have Congressman Michael Cloud to discuss the CARES Act. This act is aimed at providing relief to individuals and businesses that have been negatively impacted by the novel coronavirus. Also speaking today, Chief Roy Boyd and Police Chief J.J. Craig will discuss ways that Victoria's Law Enforcement Task Force have addressed reports and violations of Victoria's stay home, stay safe orders within the community. Last, also Dr. McNeil will be here to provide an update as well. Last, our mayor and judge will reinforce the stay home, stay safe orders that are currently in place. Because we have so much information packed into today's briefing, we will have limited time for questions between each segment. We want to be mindful of our presenters' time and of those who are viewing. Therefore, we'll allow up to about 5 minutes of relevant questions following each segment. We do ask that you keep your questions related to the topic at which the speaker is presenting on. Any others might be able to be addressed after the conclusion of today's press briefing. We thank you in advance for your consideration. So to get us started, Congressman Michael Cloud, thank you for being here. I'll now turn it over to you.
Well, thank you. It's a pleasure to be with you, and it's been a pleasure as much as can be under the circumstances to work with the leadership here. This has been an issue where much of the response has been federally backed but locally managed, and so it's been good to see the work that's been done here locally to deal with the issues, to look at the data that's available, and make the decisions that are relevant for our community. I am a member of this community, so I certainly appreciate the work that's being done. Wanted to take a moment and kind of give an update on some of the top-line federal response that's been related to this issue. Certainly about 10 days ago, we were in Washington, D.C. For the passage of the CARES Act. And the CARES Act did a number of things, providing much-needed aid to the medical community and those on the front lines dealing with this scourge on our nation and the world, indeed. And so happy to see that happen. A lot of the questions that we've been getting have circled around 2 provisions of the bill. One has been, of course, the rebate checks that are coming and people wondering what's going on with those. Basically, it's $1,200 for a single person, $2,400 for a married person, $500 per child, phasing out at about $75,000 of income. You do not need to apply to receive those. Most people should begin receiving them. I was on a phone call with the Secretary Mnuchin this morning, and he said within the end of next week, the first batch should start receiving those. We do realize that there are some people who are underbanked or their taxes, we may not have the information from the federal government perspective to get those checks and rebates to them. Mostly will be direct deposited, but there will be a website set up to where people can submit their information in order to help the processing of that. Of course, in a country of several hundred million people, there will be some anomalies and people overlooked, and we'll take those on a case-by-case basis. But the vast majority of people should start seeing that pop up into their account by the end of next week. Probably the biggest thing that we've been dealing with and getting calls with is the Paycheck Protection Loan Program. This is the loan program that allows small businesses to apply to help meet the payroll needs of their company, with the provision that as they're able to keep their employees on on payroll, that loan will be forgiven in the long run. And so it's a good program, but we're working to get the information out. The good news is that within a week of passage to the following Friday, the program was online, and that's unheard of in federal government terms. Usually these things take several months. With that, there was an understanding of the need to balance speed with perfection, and so it has not been perfect in the rollout. And so we are talking with small business owners every day and lenders to work through the bugs of the program. Was on the call this morning and spoke with the vice president and the chief of staff about some of the questions that we've been hearing, and they are working to address those. And actually we'll have new guidance related to some of those concerns out this afternoon. And so that will be very helpful to helping move this along. Again, if you have questions along any of those lines, feel free to reach out to our office. You can see us online at cloud.house.gov to get contact information. Our staff is still working to make sure that all these needs are covered and addressed, and that the response goes as best as possible. Part of the funding was, of course, funding that went to deal with some of the recovery efforts, and much of the federal funding went to the states, and for the states to delegate that out to the communities. Victoria was able to receive in that first tranche of CDBG funding grant of $355,657, so that will be on the way as well. We're also working, of course, with the local officials here, understand the challenges with keeping the testing site open and the supply chains across the country just being taxed, really, and the capacity across the nation being the supplies. We need more, of course, than we have, and so we're working to do what we can to work with those supply chains and make sure that gets open. One last thing I wanted to address before handing it back was just for citizens to be aware that anytime we're in a situation like this, and unfortunately there are bad actors, and when they know that checks are coming in the mail and the IRS is going to be dealing with people, there's going to be people trying to scam people. So already we've heard of that, and the Treasury sent out some guidance today, and we've posted it, or we'll be posting it this afternoon so you can see that. But basically, if you're getting calls that claim to be from the IRS and they're asking for your banking information or asking for credit card information or those kind of things, it's a scam. The IRS will not be calling you. They will not be contacting you on social media or anything of that kind. We have an easy one-step process to deal with this, and that is basically hang up. You do not need to worry about that. And of course, if you do have issues, feel free to reach out as well, and we'll continue to do our best to support the work that's happening here.
Thank you so much, Congressman. As a reminder, to reach Congressman Cloud and his staff, it is cloud.house.gov. And once again, the scams, if you get any calls about bank info or your IRS, asking for your Social Security, things like that, just hang up. At this time, we will open it up for about 5 minutes worth of questions for Congressman Cloud.
Congressman, you mentioned
Yes.
the grant, the $350,000 grant that Victoria has already received. Can you touch a little more on maybe what that will be used for, if there are already plans in place directly?
Well, as I said at the beginning, it's federally supported, but a lot of these decisions come locally. And so actually the funding decision came down to the state. Now, we work with our communities to help make our case for the community. And so we're always on the phone relaying the needs of our community, but those decisions are made at the state. And then, so once the funds are here, that's really up to the local authorities here, the people elected to make those decisions,
You also touched on obviously supplies being limited and that being a nationwide issue and here in Victoria as well. And you said you're working on that. Can you describe a little more what that looks like, or when maybe we'll see more supplies or changes from that?
A lot of that is in the same vein of, we have our ear to the ground, and we're talking to people across the district all the time about what the needs are, and then working to help be a part of making our case at the federal level, to other supply chains. We've even had business owners come up and be willing to support or donate supplies, make purchases from overseas to help get supplies to our district. But then there's also the challenge of, as an example, a number of counterfeit masks coming out of China right now. And so we want to find the supply lines, but we want to do it properly and make sure that the people are protected and these supplies go to where the need is met. Yeah.
Any other questions?
Yeah, with regards to small businesses, there was some word that you could go as a small business owner to any bank, but I don't think that's very accurate. Can you shed some light on the avenues in which a small business owner, do they go to their particular bank, or is it open?
The first stop should be your local bank if you're a small business owner. You can go to the SBA and try to get direction, but the best, quickest, easiest thing to do for most people will be to go to their bank. And so the idea behind the program was to maintain those relationships between an employee and an employer and the bank and their lender, and to work within the current relationships, because ideally this is supposed to be a bridge to when we begin to crawl out of this. So we're trying to maintain the infrastructure that exists and the relationships that exist as much as possible. So most lenders do have the ability to do that. There are some who hadn't worked with the SBA in the past, so they've quickly gotten up to speed being authorized to work with the SBA. But this new program does not follow the old SBA guidelines or processes. It's meant to be expedited. Now, again, that's not to say, anything time you ramp up something this quick, there's going to be little challenges in the nuts and bolts of how things are processed. So some of that's occurring, and each day I called back the banks, and it's getting a little better and a little better and a little better. Still some challenges that we're working through, but definitely the first place to start is with your local lender.
So what are the extra steps one has to take if they don't have, and you kind of mentioned it, that if they don't have a checking account or savings account, something to direct deposit the CARES Act funds into?
Right, for the individual
what are they
rebate
gonna
checks.
do?
Again, I was on the phone with the secretary this morning, and they're working on, by the end of next week, the first thing they're trying to do is do the easy process. People that we already have information for, let's start getting that out. And then by the end of next week, they also hope to have a website put up where people can begin to get their information out there. And so, I'm sure there'll still be people who, that's even a challenge too. And so we'll work to tackle each hurdle as it comes. A lot of times in these federal programs, we'll take months to work out all these bugs to get it perfect, and then we'll launch it. Because of the importance to move these things right along, we're kind of having to, we'll take each hurdle as it comes and deal with them as best as possible. So it's not perfect, but it's definitely probably one of the best things, way to address the situation as it is, to begin to deal with these things in a quick manner.
We have time for maybe one or two more questions.
We're certainly in a different set of times
Yeah.
with regards to how we're conducting business, conducting meetings, and what have you. There's word that businesses are going to be, or can start taking either, like as we enter this building, they take our temperature. Is there something that we can get back to, local businesses can get back to opening their doors if there's a process, say for instance, we were to walk in and we were to have our temperatures taken? Have you heard anything like that, or what? Can you shed some light on that?
Yeah, when it comes down to each locality, I'm going to refer you to the county judge, the mayor, of each community. I can tell you from the federal perspective, as we're looking at the data that's coming in, and this is meant to be an encouragement, not to throw off regard or anything, but the data we see coming in is encouraging that there is light at the end of the tunnel. That doesn't mean that there's not still work to do and that it needs to be taken seriously. But we should be encouraged that this will not last forever, that we will get through this, that we will come out as a stronger nation, a stronger community eventually. And I imagine, April 30th still looks plausible as a date. Now, that's not going to mean that we walk in and suddenly flip on the switch and the economy just revs up. I imagine it'll be localities and industries that we begin to see come online, so to speak, and people work to get back to some sense of normalcy. So that's how I would imagine it would progress at this point. There is hope on the horizon, still some challenging times ahead, no doubt, and certainly for the families and individuals who are dealing with this, your heart and prayers are with them, and we're doing everything we can every day to mitigate the damage as much as possible.
Thank you all for your questions, and thank you, Congressman Cloud, for your time and for being here with us today,
Sure.
and for that reminder that there is light at the end of the tunnel. We appreciate you.
Thank you.
At this time, we'll thank him again for attending, And then we will welcome into the room Dr. John McNeil in just a second. In the meantime, I want to remind you, in case you're just now tuning in, as of 2:30 p.m. today, once again, investigations still are ongoing. We have 2 new cases that are still being investigated, which brings us to a total case count in Victoria County of 61. We do have some hospitalizations, but the majority of those cases are showing improvement. We have 8 recovered and hospitalized 9. As Dr. McNeil mentioned yesterday, we temporarily have suspended the specimen collection site at the community center due to a reduction of swab equipment availability. There are other sites available in Victoria that do this same testing. However, this does mean we need to conserve tests so that they're available for high-risk exposures. I will now turn it over to Dr. McNeil to provide a different update.
Good afternoon. I have a brief statement that I'd like to go through today, and I'll read to you. After that, I will answer some questions. Ashley's just gone over the numbers. If y'all have any questions on that, we will take some brief questions afterwards. I would like to be able to limit the questions, if possible, to what I'm about to read, because I'm sure you'll have questions about that. As local health authority today, I'm going to terminate the control measures placed on Post-Acute Medical North that were done on April 2nd. They have completed and complied with all of the measures described in the order, and they've been very cooperative. They've identified the patients that were positive, and they have completed the testing and isolation of the COVID patients and their employees. This will allow them to convert their PAM North facility into a facility dedicated to the treatment of COVID-positive patients. As a result, other healthcare facilities in our local area will be able to isolate COVID-positive patients there, and these are patients that require hospital-level care, and they will be in a single location. The Centers for Disease Control recommends, their recommendations are very clear, and they state that whenever possible, patients with the same infectious disease, such as our COVID infection that we're dealing with, be cohorted and treated together. It has been repeatedly proven that cohorting these patients saves precious resources while limiting exposure to other patients and healthcare workers as well. This is a trailblazing effort being done by Post-Acute Medical in cooperation with our community that will have obvious benefits, and I will tell you that few other communities like this have been able to achieve a goal like this. I actually got off the phone a few minutes ago with the State Health Services, and I spoke with them, and I asked them, are there other hospitals that are doing this? And the person that I spoke to, the director in San Antonio, did not know of any in our region. So we're glad that we can do this, and I think it's going to be a good thing. I'll answer questions briefly for these.
Sure. Thank you, Dr. McNeil. We'll now open it up for questions.
Yes, ma'am.
So are other cases in maybe other counties that are surrounding us in the Golden Crescent region, are they going to be able to ship these COVID-19 positive patients into the PAM North facility?
I was wondering if that question would be answered because I didn't have an answer to it yet. This is all started this morning with a conversation that I had with Dr. Adam Burek, who is their Chief Medical Officer for their nationwide facilities. And they had stated that they were willing to do this, but I would, of course, have to lift the order that said they could not move patients in and out of the facility. They have identified all the patients that were COVID positive, and those patients are going to be kept in that facility. The Centers for Disease Control is very clear that it is in the interest of the other patients that they be removed from that facility if possible. They will be transferred to other facilities where they will still be quarantined and watched very closely in case they are one of the rare patients that just has not developed disease, and while they were negative, still could turn positive. We're going to be very careful about that. There will be no risk in that. The benefit to this will be very simple. When you think about it, we're going to try and put as many of the COVID positive patients in one place. If you're an epidemiologist or an infectious disease professional, that is what you really want, because we will have patients out there and we will have healthcare workers that are completely protected, and they'll be in all the right protective equipment. We won't use as much protective equipment, and we won't have patients basically all over town with the same disease, if possible. Now, the answer to your question that I should have told you in the first place was that I'm not really sure exactly of the mechanics of exactly how it's going to work. I know that they will be hospital-appropriate patients that are moved there.
Will the nurses will they stay at their previous employer?
One of the benefits of this is that there will be dedicated employees out there who will be working in that COVID unit. So these are very caring, brave, dedicated, for lack of any better term, very dedicated people who are doing a dangerous job. This is what's going on all over our country. There are a lot of hospitals in the bigger cities that have by necessity become COVID hospitals, and the workers there should be applauded. These are healthcare professionals that are going above and beyond every day to do their job, and I have nothing but the highest praise for them. But the answer is that there will also be other physicians, because we have specialists that go to all the hospitals, but you know, they're very careful. They don all the appropriate equipment, and they know that they're going into an area where they have to be very careful. And of course, when they leave that area, that equipment that personal protective equipment will come off and be disposed of appropriately. The whole idea is to have one place where we can have these patients, and it's a good idea.
Any other questions?
Yes. Will patients currently hospitalized at other locations be transferred to PAM, or is this just for new cases that come up?
That's the plan. Hopefully, I know for sure that if Pam has any, I'm pretty sure that if Pam has any other patients that are COVID positive, they'll be placed in that unit out there. The idea is to be able to place these patients in one place where we can care for them appropriately. They'll get good care out there, and it'll be safer for the community. It's really the way to do it if you're able to. And when they called this morning, I spoke to the state health services. I spoke with the epidemiologist. I spoke with the director. I spoke with the judge. I spoke with the mayor. I spoke with everybody. But we've all agreed that this will be a good thing for our community. And I'm telling you, I feel like we're going to be the envy of many communities because of this action.
And they have 26 beds, I think. Is that going to be enough, or will there be more added to treat everyone needed?
I'm not sure exactly how many beds they are, but I think that we'll see how that goes. I mean, that's going to depend on our peak. That's going to depend on transmission, and that's going to depend on how many patients that actually have COVID that require hospitalization.
We have time for maybe one more question, last question.
Quickly, the FDA approved an antibody test. Can you shed some light on that discovery today?
Well, you know, I can tell you real briefly as far as the antibody testing goes. What the antibody testing does is basically just tell you if you've been exposed to the disease. There's a lot of different information out there, so to speak, on these tests because some of the tests are different than others. For the most part, once you've been exposed to a disease, your body will develop antibodies to it, but we don't know how long the antibodies will last. So you may be immune to a specific disease, such as COVID-13 if you've been exposed to COVID-19 if you've been exposed to it before, but we don't know how long that immunity lasts because it's too new of a disease. So it's a good test for telling if you've been exposed to it, but it's not a real good test for telling if you have active disease. So this will be something that we will utilize later to see who has developed immunity to this, and there will be some interesting studies done on that. For the most part, the tests, depending on the manufacturer and depending on the specific immunoglobulins that they look at, the tests are different. So it's a interesting forefront of medicine.
Thank you, Dr. McNeil. So just to wrap up what Dr. McNeil just addressed and reported today, control measures on PAM North have been terminated since they've abided and complied. They've also completed their testing on everyone there at the facility, and PAM North will be made into a single COVID-19 confirmed location facility. So thank you, Dr. McNeil, for those updates. At this time, we will exit the room and we will welcome Chief Boyd and Chief Craig into the room to discuss law enforcement task force that has been dispatched to address concerns about violations of our stay home, stay safe order. Chief Boyd will begin that topic shortly. Thank you.
Good afternoon. We'd like to advise everybody that the Victoria County Sheriff's Office and the Victoria Police Department have formed a task force to address violations of the Stay Home, Stay Safe order. The task force was also assisted by Constable Gary Schmeckel, who we'd like to thank for his efforts in this and his support during this time. As part of the task force, we're conducting an education effort. So far, we have reached out and contacted 418 businesses throughout the city and county of Victoria. We are providing education flyers to business owners, to educate them about the conditions of the orders, as well as posters to put on their doors in order to advise their customers of the conditions and need to follow of the order. If you have a small business that has not been contacted by the task force, we ask that you contact the COVID hotline at 580-5796 so that we can come and visit your business. And now I'll pass it off to Chief Craig.
Thanks. Good afternoon once again, Chief J.J. Craig, Victoria Police Department. Our department has had more incidents responding to incidents of the stay home, violations of the stay home, stay safe order. We have immediately acted upon those calls and complaints and will continue to do so. To date, we've issued 3 citations and are conducting 1 additional criminal investigation for individuals that are violating the stay home, stay safe order. Our officers are out there, and they're going to continue to be. One of the things that I want to remind people is in our community is that our officers will take enforcement actions when confronted with situations where individuals are violating the stay home, stay safe order. Lastly, I just want to say that I need the community's help in one area. Help us help you. And what I mean is when you call and you call for us to respond for whatever the issue is, understand that there's protocols for answering those calls. Please answer those calls honestly. They're for your protection and ours. The last thing we want to do is respond to a situation where individuals have not been entirely honest about the situation, and we put the citizens at risk or our officers at risk. So I'd ask for that. And at this time, we'll open it up for a couple of questions, should you have them.
I apologize if you said this to start, Chief Boyd, but can you discuss again who's making up this task force and the primary goals it has?
The task force consists of the Victoria County Sheriff's Office and the Victoria Police Department. Fortunately, Constable Gary Schmeckel also volunteered and came on and helped us out in this effort to educate. Our primary goal is to educate the business owners and provide them with literature that gives them some guidance with regards to running their business during this time under this order, and also provides them with some literature that they can stick up so that their customers can be aware of the conditions of going into these areas and shopping. We find ourselves in small locations like many of the small businesses are. It becomes very difficult without a little bit of assistance to ensure the social distancing that is required. And our goal is to help to educate people on that and to work with them to make sure that happens.
Seeing no further questions at this time, we'll ask Mayor McCoy and Judge Zeller. They'll be next to come in and speak.
Good afternoon, ladies and gentlemen. It's been several days since the mayor and I have participated in a press conference, so I wanted to visit with you today about a few things, much of it based on questions that I've gotten in recent days. As everyone knows, Governor Abbott issued an executive order on April 1st requiring Texans to stay home through the end of the month except to provide or obtain essential services. That executive order from the governor specifically required certain businesses to temporarily close. It also identified a long list of businesses as essential based on CISA guidelines. And a copy of that document is on our website for the public to review and has been for several days. That executive order from the governor also specifically removed our ability locally to take actions that are inconsistent with his order. Locally, we have only a limited ability to implement additional or differing requirements. The mayor and I have used the ability that we do have, however, to require the use of social distancing guidelines from the CDC, and we've also used the abilities we do have to require that sick people stay home, which we feel is reasonable and balanced given our circumstances. Speaking of those circumstances, our teams report to you every day about the increases in local case counts and conditions. And I know that when the public sees those numbers, it can be alarming, but for every change in numbers that you see daily, there are calculated discussions and decisions that are being made behind the scenes to protect the community, such as the steps to make Pam North a COVID hospital, which is an important local step for our community that meets our community's needs. Of course, Dr. McNeil gave more of the details related to that. While other states and jurisdictions are focusing on models, perhaps inaccurate models that appear to change daily, our approach has been based on the knowledge we have of our community and local conditions, combined with the expected changes to our local conditions, as well as our medical infrastructure's ability to accommodate possible surge demands. The PAM outbreak and the effect it has on our healthcare professionals has been of particular focus recently. It's absolutely critical to protect our frontline medical personnel. I've mentioned previously in these press conferences that when the wheels fall off in a situation like this is when our healthcare and medical professionals get taken out of the picture due to COVID exposure, which requires them to isolate for extended periods of time. Or worse yet, if those same doctors or nurses come back to the hospitals as patients. Preventing that from happening is why we work so hard to flatten the curve, to prevent our hospitals from becoming overwhelmed, and every indication suggests that we have not seen the peak yet. We expect that cases will continue to rise in the coming weeks, and that's why it's so critical that we all do our part and do everything we can now so that the impact will be lessened in the week, 2 weeks ahead of us. This has been a difficult balance. I know that I speak for the mayor in saying that the decisions that we make, the things we don't implement, they're all difficult discussions because the fact of the matter is the folks we serve in Victoria and Victoria County represent and hold a wide range of opinions, and those opinions don't always agree on what should be done in this instance. There are those who feel like what we've done has been right on point. There are those who are insistent that much more draconian steps should be taken. And then there are others still who I would call the silent majority who recognize that it's not mandates or orders that are most effective, but rather us as a community behaving responsibly and acting as we should in light of a global pandemic. Each and every member of this community has a role to play in stopping COVID-19. We've talked about the steps in that role that ought to be happening. Glad to see everybody here following the mask best practice advice. And especially in the coming days, our roles will be increasingly critical. What we do today, what we do in the week ahead will impact the numbers that we will be reporting 2 weeks from now. And so we all need to do our part, and I appreciate the vast majority of people in this community who are doing their part, who are acting responsibly and giving this situation the attention that it's due and taking the steps necessary to help flatten the curve and slow the spread. So with that, I will turn things over to Mayor McCoy.
Thank you, Judge. First and foremost, I would like people to understand that we do not make our decisions in a vacuum. There's a lot of people, as I stated earlier, behind that wall that we rely on. They're experts in health-related matters. We rely heavily on our district attorney and our city attorney to advise us along legal matters in all the decisions we make. I think we're very fortunate to have the support we have from elected officials higher up than ourselves. As you saw here today, Congressman Cloud was here. He's a member of our community. I have been, since the inception of this event, almost in daily contact with our state representative, Jeannie Morrison. I call her. Her chief of staff, sends updates to the judge and I on basically a daily basis of what's going on at the state level. I also have at least weekly conversations with Senator Colcorst, who is very attuned to what our needs are here in Victoria. And so we get a lot of solid, good support from those up and down, all the way from our local government all the way to our national government. So rest assured that we take what we're doing very seriously, and we seek very solid guidance when we make our decisions. We do not make them in a vacuum. And quite frankly, we never stop in making these. This past weekend, we decided to give people a break here at this facility, but that didn't mean the judge and I took a break, because we get constant contacts. David Gonzalez calls us, and everybody who left here knows that the judge and I, either one of us, if we get information from Dr. McNeil or David Gonzalez, all we have to do is pick up that phone and call our Rick McBrayer, who's our emergency management director here, and this whole facility lights up again when needed. So don't ever get the idea that we're not on top of this thing, because we are. And now for weeks, I've been working hard to protect the city from COVID-19. I've declared a disaster. I've suspended regulations at the city level. I've ordered social distancing, and most recently, I've ordered non-essential workers to stay at home. I've implored the community to abide by CDC guidelines, including the use of cloth facial coverings when in public settings. These are things that I've been saying and we've been doing for weeks now, literally weeks. But I still see and receive reports about citizens who are out around town behaving as if they don't think this virus is worth taking seriously. Well, I guarantee you it's worth taking seriously. And I think you heard that from our Chief Craig and Chief Boyd today. We are taking it seriously. We've had task forces out there, and as you can see, our law enforcement people are going to be taking action, and they will be taking action. The question I have for people that I read are constantly saying, well, I see a lot of people out around town. My question to them is, what are you doing out and around town? If you're seeing all these people out there, there will never be a situation where the streets of Victoria will be totally bare. Why? Because people have to go get their groceries, they have to go get their medicines. And so those people looking for the streets to be empty, then just look all you want, because that will never happen. And it doesn't happen in any community that I know of that has lockdown orders or whatever you want to call them. You need essential services. There's risks involved with essential services, but the benefits of them staying open, it's been determined, far outweigh the risks that we have to take in order to simply eat and get our medicines and stuff. But when you go out, even for essential services, you must act responsibly. And that's what our task force is doing. I think the chief said he's visited over 400 businesses. That's a lot of businesses to be. So yes, it is serious, and we take it very seriously. We have more than 60 cases in our community, folks. And my question for you today is, what are you doing? What are you doing to help me fight this disease? What are you doing? Are you wearing a face covering in public? We hear concerns that asymptomatic individuals could be contagious. And I can tell you those guidelines have changed at the level of CDC from the inception of this disease until recently. The orders have changed, and we follow those guidelines in our advice to you. So what if you are that individual? What if you're that individual that's carrying those asymptomatic disease? It could be any of you. And I ask you again, are you wearing your face covering in public? If you're going out in public without a face covering, you are putting your friends, family members, co-workers, and neighbors at risk. Are you staying inside your home? As I alluded earlier, what are you doing where you see all of this activity if you're not out yourself? Are you out yourself just to be looking around? Are you out trying to seek essential services? Social distancing is the best tool we have to prevent this disease from spreading. I have said that over and over and over at this table for the last month now. It's been almost going on a month. Don't be part of the problem. Be part of a solution. Don't put your community at risk. Don't put yourself at risk. Do your part, cover your face when you absolutely have to go out in public, and stay home the rest of the time. Help me fight this disease and making sure you're not spreading it yourself. And I'm going to say one last thing, Judge. I've tried to not ever put words in your mouth, but I think you will agree with me at this. We will do everything within our power to protect the citizens of our community. Rest assured. Thank you.
We'll open it up now for questions, if there are any.
Judge Ziller, if I heard you right, you mentioned early on that there were some orders between Victoria County and orders given by the governor.
Mhm.
What specifically, although that may be in conflict, what were some of those orders that either contradict or may be in conflict with the governor's orders?
Okay, so the question is, there are orders from the governor, orders locally. What, if anything, might be in conflict, or what might be different about the two? Well, the governor's order, executive order that went into place April 1st, like I had mentioned, specifically identified categories of businesses that have to temporarily shut down. He also identified, using CISA guidelines, what he is calling essential businesses, which is a very long list of businesses that are essential and that his order did not apply to. What we did additionally, and it is a difference, not an inconsistency in our estimation, what we did was required that even businesses in that essential category, even though they're open, they're going to be open, we required that they implement and adhere to the social distancing recommendations of the CDC. The 6-foot spacing, the social distancing outlined on the CDC website. So we put that in as a requirement, which is a step beyond what the governor said. He said that folks should do that. We said that no, everybody has to do that. Secondly, another step was to require that sick people stay home. Specifically, it's a concern of ours if there is a COVID-positive patient who's out and about. That's a huge concern. We felt it's quite appropriate to require them via an order to stay home. This clearly spreads from sick people to well people, and we can't be having that. So the social distancing requirement, the sick person stay home requirement are two areas where we took it a step further. But to that question, I'll make a few additional comments. Really, beyond that, there's not a lot of abilities we have. The businesses that are identified as essential per CISA guidelines, we don't have the ability to say that they're not essential. We don't have the ability to constrain, to reduce that list to a more narrow group. We don't have that ability. That would be inconsistent. Theoretically, we do have the ability to, and we did it to a certain extent, added some categories under the essential heading. I know the mayor had written an order identifying hotels as essential, which we felt they were. But, you know, a conversation I had with someone this week who's kind of upset, saying we need to repeal our local orders and get the economy rolling again. My frank conversation with him was, number one, it's not the mayor and myself that have, we didn't create COVID. We are not spurring the economic downturn that we're likely seeing. If he and I were to rescind the orders we have in place, we would still be looking at the same tough economic outlook. Frankly, we didn't create the economic hardship, and we don't have the power to fix that. What we do have the power to do is within a narrow realm of orders to tighten things up further from what the governor ordered, and to do things locally that we think are appropriate. The PAM hospital, being now a COVID hospital, is one of those. So I empathize with those on every side of this discussion. Those concerned that we haven't done enough locally, those concerned that we've done too much. I see the points that everybody's making. At the end of the day, the goal and the task that the mayor and I have is to take all those considerations, consider them, analyze them, but at the end of the day, make a decision that we feel is best for this community, and that's what we've done every step of the way, and we'll continue utilizing that same approach, using not only feedback from the community, but the experts that the mayor referenced earlier in this room behind us, who we visit with constantly throughout the day.
And if I may add to what the judge says, it's easy to armchair quarterback, it's easy to do, but I'm going to tell you one thing that everybody out there does not have to do. They don't have to take this pen and they don't have to put their name on an order that may cost somebody their life, okay? So I'm asking for all those naysayers out there, put yourself in that position sometime. And then you might think a little differently about the depth that we go to in making these decisions. And so we do what the best we can within the legal framework we're given. And as like I said, I'm willing to do whatever it takes to protect the citizens of this city.
Oh, it looks like that's time. So I will close things up with that. I want to thank everybody for being here. For those watching online, those who may be watching online later today, thank you for your interest. Want to remind folks that the specimen collection site is temporarily not operational until we get additional supplies. Those supplies have been steered towards our frontline medical workers, which is why they're not at the pod site right now. We do expect that to be up and running, though, when we do get more supplies in. Reminder, the case count, 2 new cases still being investigated today. Total case count is 61, 8 have recovered, and there are currently 9 hospitalized. I know it's been mentioned, but to remind everybody again, we won't be having press briefings this weekend, Good Friday through Easter Sunday. The hotline will also not be operated during that time, but we'll be back again, resuming things on Monday, April 13th. And we'll continue posting daily COVID-19 information on social media. So with that, I want to thank everybody again for being here,
Thank
and
you
we
very
will
much.
see you guys soon.
Thank you very much.